I have a patient who had diabetic neuropathy for 10 years. They had tried everything. They had been to all the doctors, neurologists, and nobody was able to do anything except give them gabapentin, Lyrica, Cymbalta. And he had got to the point where he was going to Disney with his granddaughters and he was having to ride around on one of those little scooters. And it just made him feel like less of a man. And coming into my office, we talked about he had already had a partial amputation of one of his toes because of an infection. And he said, "Doc, what can you do for me?" And I said, "Well, I don't think 100% recovery is viable, but let's see what we can do, because this is the only option that we have to reverse it from a more natural standpoint." And most of our patients see anywhere between a 60 to 90% improvement over a certain amount of time. He was going to Disney in 3 months with his granddaughters, and he said, "Doc, I really want to be able to walk." And I said, "Bobby, I don't know. Let's just see. Let's see what happens." And 3 months goes by, and he goes to Disney, and the swelling was a little bit better, his feeling was a little bit better, but when he went to Disney, he still had to use the scooter. So, I try to set those expectations with him. Well, he's still doing everything. He's doing the majority of the at-home care. He's, staying faithful. And then in another 6 months, he's going back to Disney with his granddaughters. And guess what happens this time? He doesn't need the scooter. He's able to walk around. Maybe he has a little bit of swelling in his feet, but he's able to do it all without having to feel old, having to use an assistive device. And he came to me and he thanked me, because this was life-changing for him, because he was able to do something that he wasn't able to, and it was just only getting worse. So for anybody out there who has diabetes, you have neuropathy, you just have to be willing to do the work in order to get better, but it can really change your life and how you feel, not just from a physical standpoint, but from an emotional standpoint as well. If you want to learn more about what I do and how I help people all over the country with their neuropathy, then click the link. There's a free masterclass where I talk about how neuropathy happens, how we resolve it, and you can do this all from the convenience of your home. So make sure you follow, share this with anybody that you know that is suffering from neuropathy, and let's get them help.